Soonthornsima. Folks, I have an easy job of just teeing this thing up, but you know what it takes to get this event going, and by far the largest ever SQL Saturday event. Thanks to William and the team again. Would you all stand up again? This is such a significant event. Thank you all. But thank you, all of you, for being here at 8 o'clock in the morning. You know, when William told me that you're going to start up at 8 o'clock, and I said, you're kidding me. How many techies get up at 8 o'clock to come talk, come listen to me talk, right? But you all are here, so thank you so much. Whoa, what happened to my screen? Sorry, did I miss something? All right, there you go. Thank you. How about that? A round of applause. Now, I'm gonna go through this very quickly. William said I have 15 minutes. Otherwise, you're gonna get a hook, just pull me off the stage. So I won't have time for any questions, but feel free to touch base with me afterwards. You know, the title of this presentation is pretty easy. How many times have you seen presentations that talk about change? Right? So easy, right? Everybody can talk about change. But something is different today, especially in the world of healthcare, and I'm going to touch on this at a very high level. But more importantly, talk about some of the technology that you all are working on and how these technology efforts are actually accelerating and changing our industry in a very, very dramatic way. And lastly, what you all are doing here in our community and has a significant change to our community and the economic development of our state. So without any further ado, let me jump right in. Briefly, just a quick commercial. I can't do this without saying this, otherwise the marketing guys will say you can't speak another word at any public event. So this is Blue Cross Blue Shield of Louisiana. We are a 1.5 million member that we support. We are the oldest health insurance company in the state. Without any further ado, I'll just say we are going through some significant change. Not just Blue Cross Blue Shield, but the entire state of Louisiana and the healthcare system. So let's touch on that a little bit. When you talk about healthcare, how many of you have heard about Health Insurance Exchange, ACA, Affordable Care Act? Okay, good. We're going to touch on that. But you know, we can spend a whole 15 minutes talking about Obamacare, but we're not going to do that. There are some other significant changes, good changes that are going on, including Health Insurance Exchange. And all these changes are designed, truly, all these changes are designed to impact three things: improving cost, quality, and population health. Every entity in healthcare, whether you're a payer, providers, physician, healthcare services, all these entities strive to improve these three things: healthcare cost, quality, and population health. This is what we call the triple aim. So let's talk about some of these changes, but the way I'm going to present this is going to be in the context of capabilities. At the end of the day, what we do in technology is to empower business processes and introduce capabilities, right? Advance the capabilities. First set of capabilities that's happening in the marketplace today: expanding use of technology for the providers. At the end of the day, this is all about making electronic health record available and expanding the use of it. Why? To improve quality, safety, and at the end of the day, hopefully we can gather enough information for all these electronic records and do some population health with big data. Okay, we'll talk about that in a minute. But what's happening in the marketplace today, in our industry I should say, is the government is the major enabler of this. There are a significant amount of monies being thrown around, I shouldn't say thrown, targeted to providers, healthcare providers. Is that a slip? No. Genuinely, this is all about the triple aim, okay? Quality, cost, and population health. So incentives are being provided today to all hospitals, large or small, Medicare, Medicaid providers. Why? Because we need health records to be electronic, okay? As you all know, when data is electronic, it's a lot easier for us to do some things with, right? And another thing is, It's about safety. Imagine having electronic health record in your physician office, and he or she is able to share that information with other providers in a care coordinated fashion. That's the goal of our country, and that has been going on for now almost 8 years. Another major capability is about data. Wouldn't it be nice to be able to harness all this data? Have y'all ever heard of big data, the concept called big data? All right. Healthcare, probably by far, has some of the biggest untapped health data and big data, okay, among all the industries. We have a long way to go, but we have a ton of data. So what it is, wouldn't it be nice to be able to tap into public, private, payer, provider, pharmaceutical, all this data point that could come together in order to identify disease trends and impact some policy, health policies. And that's basically the goal of the country, the federal government, the state, and local community. We actually have the Chief Technology Officer in our room today. Lucas, would you stand, please? Lucas is our Chief Technology Officer at Department of Health and Hospital here in our state. This big data is a huge deal for us in healthcare. We're hoping that we can impact quality and population health of our community across country. So what are some of these concepts? Again, I already mentioned it. Harnessing all the data from multiple sources, public or private. And some of the things that we do with this stuff is using standardized data and non-standard data, structured data and non-structured data. I'm talking about physician notes. There's technologies out there today, as you all know, that can use text, you can harness text messages and so forth. And imagine bringing all this together and identify at the community level, let alone at the population, at the community. Every community is different. And that's the power of electronic health record and data. Let's talk about healthcare reform. This is about making healthcare accessible through affordable health insurance programs that's provided at the state level and the national level. And this is what Affordable Care Act is all about. This is a very complex change. So the idea is eligible consumers, as you all know, eligible consumers can go online and shop on its health insurance marketplace. It's no longer called an exchange, it's called health insurance marketplace. If you're eligible, the government will subsidize part of your insurance premium. This is a huge program, and we think it has a huge potential for the country to absorb some of the uninsured population. At the same time, behind the scene to make this happen, folks, oh, by the way, have you heard of 10/1? October 1 is when we're supposed to go live, and our citizens are supposed to be able to shop. Behind the scene, this is a huge undertaking. We're changing the business model of health insurance and the providers. We're changing business processes and all these capabilities. A lot of technology change going on behind the scene. So behind all these capabilities I just talked about, whether it's electronic health record, big data, or Affordable Care Act, what you guys are doing today with SQL Saturday is you're bringing in technology stack with all the critical components that arguably every single piece of technology you'll be talking about today will enable these change. Okay, every piece of it. From the data analytics, integration, collaboration, and even delivery platform. Little ad here, Microsoft. Now, I'm a big fan of Microsoft. Why? Because our guys use it. Okay, so we use Microsoft technology in a big, big way. Every piece of Microsoft technology is being deployed today. Whether you're in a health insurance company, whether you're in a healthcare provider organization, or any industry, let's talk briefly about SQL Saturday. SQL, I learned how to spell SQL just before they asked me to show up here. But I also learned how to spell .NET and a few other things. So if you look about data analysis alone, SQL, SQL Server, SSIS, SSAS, for those of you who are not using this stuff yet, SSIS, SSAS, SSRS, Power Pivot, all these capabilities are part of this technology stack. Okay. The integration technology, we all use BizTalk, some of you may not. .NET, doing a lot of that. Collaboration, we use SharePoint. I know some of you are in these user groups, right? Every single piece of technology that you all be talking about today, we are using to empower all these change. So far, so good? All right. I'm at the right audience here. I don't see a nod, I don't see a clap. You guys, don't you think this is powerful what you guys are using? Yeah, thank you. But more importantly, at the end of the day, it's a venue like this. Okay. What did you say we're the largest in Louisiana now? SQL Server? In the South?
Not just in the South.
Not just in the South. This SQL Saturday is not the largest in the South?
Not just in the South.
In the country?
Not just in the country.
My gosh, guys, to make this largest event, SQL Saturday, event in the country and in the world. Heck, let's go all the way, in the universe. This is fantastic. You know what this means? It's about what I call 3 C's. Commitment, collaboration, right? Commitment, collaboration, and the community. What you guys are doing for this community, what you guys are doing for each other is fantastic. So let's start with commitment. To get this big, so short a period of time, what, 5 years? To get to this point, it takes commitment. Again, the leaders in this room, okay, really they do come from the grassroots. All the user, all the text, okay, you all get together and said, this is something big we need to do. Why? In the spirit of collaboration. Okay? That's why y'all are here. You are making a commitment to help each other. And let me tell you, when I talk about technology stack, as you all know, each and every one of us can go out and code something, and we have so many different ways to do things, but the fact that you all got together, it's because some of the foundational things of doing IT, effective architecture, right? Patterns, practices, all these things are so crucial, otherwise it's so tough to get the technology to work properly. And that's why y'all are here, and I know I'm preaching the choir here, okay? Y'all here to collaborate, to figure out what are some of the pain points, what are some of the challenges and issues, and what are some different patterns in architecture that we can deploy, and where we can learn from each other. That's collaboration. And that's what fueling this commitment that you all have. And lastly, the community. Look around the room and you look at the list of the sponsors. There are a lot of new entries here. You got IBM coming down the street. You have Ameritas, and you have all these tech firms popping up everywhere, not only in and around Baton Rouge and Lafayette, New Orleans, GE Capital is here as well. We've got huge firms coming in, small firms popping up. It's about the community. What you're doing in creating this excitement for our community. Okay, so without any further ado, I just want to thank you from the bottom of my heart. Not only that you're helping each other from the technology standpoint, but you're also fueling our community, okay? For Louisiana, for our community, and for each other. So I want to thank you for being here today. And do I have time for questions? Not really. William is just telling me, I have 4 minutes. Okay. Are there any questions or, so by the way, I'll be around this afternoon. I'll get one of these tags. And we do have great presentation. I hear that we have a track for CIO too. Is that right? I'm looking forward to that because they're going to teach me not only to spell how to spell SQL and .NET, maybe some other things they can teach me how to spell. Guys, thank you for being here today. Enjoy the rest of your day. This is a great opportunity for us to collaborate and learn. Go Louisiana.
Any questions?